don't know if there's one singular moment, but I think just the feeling of like, even to this day, like I love that one-on-one, face-to-face, client or patient work. Even in my current role, I wish I had a little bit more of that, where they can just come to me and they're trusting in me, right? That relationship building was there. They trusted me with such personal information. I knew, like, okay, I really want to do this. I really want to go deeper into public health, and I want to be embedded in the community, make communities healthier, talk to folks, see what's going on in their lives, see how we can break down barriers that might be causing them not to go to their appointments, or not, like, why aren't you able to use condoms? Is it economic? What is it? Is there no store that has them? So really, I really loved that aspect of, like I said, meeting one-on-one with folks, excuse me, going to the community and really providing health education. I knew I wanted to keep going from that point on.
Awesome. And you pursued your Master's of Public Health in Community Health
Yes.
Education at California State University, Northridge, for anyone that was interested in knowing that.
Yes,
Um,
Tucson.
and while you were there, you had a role as a health education and outreach intern at comprehensive community health centers. So also a little bit
Yes.
about that experience.
Yeah, that was a cool experience too. Actually, one of my coworkers ended up being my supervisor there. So that was interesting, kind of seeing her in that role, being my supervisor. But anywho, yeah, I was there and I was able to actually develop a comprehensive curriculum for sexual health education for teens. And so I literally had to go from start to finish, from the ground up, creating an
Hmm.
entire curriculum, with the action plans and everything like that, detailed all of the good stuff in there about, hey, we're going to go from day 1 to day 30 in this whole class series. Day 1, we're going to talk about healthy relationships. Day 2, we're going to talk about safe sex practices and contraceptives. Day 4, we're going to talk about teen pregnancy prevention and the whole gamut. So it was really cool. It really challenged me to think deeper into, how we can address, it was more so teen pregnancy focused. So how I can address teen pregnancy prevention and what do teens really need inside of a comprehensive curriculum.
That's a really cool project. I guess maybe trying to reflect on that experience, what were some of the more difficult things that you had to learn in building out this curriculum?
I unfortunately didn't get to talk to as many teens as I would have liked to while developing it, but I was able to talk to a few young folks while developing that. So I think that was a bit of a challenge, kind of like not knowing all of the ins and outs of what they would want inside of the curriculum, or what would work for teens, right? And of course, not all teens are the same either. But that was kind of a challenge. It was me just kind of working alongside my supervisor, developing it. Uh, I was able to utilize some research and things like that to put into the curriculum as well. But yeah, I think a little bit more of the feedback from um, teens themselves would have been helpful.
That makes sense. Regardless, I think that's a really awesome project for a master's
It was
student to
fun.
be able to
Yeah,
work on. Yeah, that
for
builds out
sure.
a real like good set of skill sets and uses a good set of skill sets to do that. So that's cool.
For sure.
Did you have any takeaways that you wanted to share from your master's program?
Takeaways, definitely staying in touch with professors. And I think I saw a question later kind of about like some advice for students. I won't say all of that part of it, but um, not utilizing, developing relationships with professors, I think, because I ended up actually having a pretty good relationship with one of my teachers at the time, and he later became my supervisor when I ended up working later on at APLA Health and HIV work. And so that proved to be very valuable. Really going to those office hours, so they know my face, asking questions in class. And I am a little bit more on the introverted side and kind of quiet and things like that. But I really had to challenge myself to let the professors know, like, hey, I'm here. I'm ready to get this degree. I want to work in public health, and I'm ready to go. So definitely pushing myself to do things like that. But again, meeting with the professors and letting them know, hey, I want to work in this field. And that, like I said, it opened up a door for me later on. So that was pretty valuable. And then also, kind of like the bachelor's, being involved on campus as well. So I was definitely involved in some public health clubs during my MPH too.
Before you worked under your professor in APHLA Health, you were a teacher's assistant at the Los Angeles Unified School District. So tell us about your experience being a teacher's assistant.
Yeah, so no public health work in that role, but yes, I was there.
Technically speaking.
Right, right. So that was interesting. Working with the little ones. So from kindergarten to fifth grade on that campus, and just literally working with all of the different classrooms at the time, going from K to third grade, fourth grade, split classes to second grade. I think I worked in every single grade during my time there and just helped the teachers out. It really was eye-opening. I obviously didn't have kids at the time, but I was like, oh my gosh, this is home. Kids are very interesting people, I'll say. And I give props to anybody who's a teacher. My mom is a former teacher. And I'm like, I do not know how you do it, but anyways, definitely a good experience there. I mean, kind of a public health part of that was food, oddly enough. I would see the kids leaving behind the healthy foods on the sharing table. They had this little sharing table in the lunch area, and they would, put stuff on there that they didn't eat or didn't want. And every single day there'd be like apples, bananas, pretty much fruits, right? Just kind of sitting on that table. And of course, the kids are eating all the other processed stuff. And it was really interesting to me. I always said I wanted to develop some kind of program while I was there to like use all of that stuff from the sharing table and maybe show them like what they could make with it and turn that into something fun. But I'm not going to lie to you, I was so busy in my MPH program. I was like, I didn't have the capacity at the time to really implement something like that. Looking back, I'm like, man, that would have been really beneficial to really show them, hey, you can eat healthy and it could be fun, like make some little smoothies or something. So yeah, it was a good experience.
Yeah, and I've heard similar situations where people have seen like that the root causes or like the health education around the food come up as an issue when they were working in a school setting, and then that spurring them to get into public health as well, which
Wow.
is
Wow.
interesting. Yeah, yeah.
Yeah, yeah. All
And
roads lead to public health.
hey, it can if you wanted
It,
to. That's for sure. It's
that's for
definitely
sure.
able to be transferred and used, and skill sets are very valuable in many places.
For sure.